and I will act as a first aider.
I am Farhana Nabila and I will act as a victim of the open wound injury.
The situation is about the victim who accidentally cut her fingertips while cutting the sausage. Let's go! Oh no, what happened?
I accidentally cut my fingertips.
Wait, I have tissue. Let's go, I'll bring it to the toilet.
Next up, I'll be explaining regarding the types of open wounds. Based on the situation that we have seen from the previous video, the type of emergency involved is a medical type of emergency. And as we all know, there are 4 types of open wounds, in which includes abrasion, penetrating wounds, laceration wounds, and avulsions. First type of wound that I'm going to explain is abrasions. Abrasions are superficial wound, in which it means that it is a type of minor injury. It is often caused by rubbing, scraping, or shearing of the affected area. It is extremely painful, but no major blood loss is involved. The second type of wound that I'm going to explain is laceration. Laceration is often characterized as a jagged cut and often caused by a sharp or irregular shaped object. It can be both minor or a major injury. It has 2 types, in which linear laceration and irregular laceration. Laceration wound may need stitches for quicker recovery. The next type of wound that I'm going to explain is avulsions type of wound. It is a major injury and it involves a tearing loose of a flap skin and may be either hanging or be completely torn off. Warning: never remove an avulsion skin flap. And also, it commonly occurs in automobile accidents and industrial settings. However, avulsions can become more critical and lead to amputation. Amputation is a major type of injury and it is often caused by a tearing force that are strong enough that can lead to the amputation of the organ itself. It causes severe bleeding and causes a lot of blood loss. Store the amputated part in a sterile wet gauze, place in waterproof container and place it in ice to store the amputated organ. Last but not least, puncture and penetrating type of wound. It is categorized as a major type of injury. A puncture wound is a penetration of a sharp object. It causes severe bleeding and will cause a lot of blood loss. It may cause microbial infections if not taken care immediately, as it is punctured with a sharp object and may cause injury to the internal organs.
From the situation shown before, it is a minor open injury, which is an incised wound. This kind of injury can be treated at home but if the bleeding lasts more than 20 minutes, you need to seek for medical care. Improper management of open injuries can lead to numbers of complications. There are several of it. Firstly, infection. Diverse group of bacteria can enter and multiply in open wound that can cause infection. Symptoms of infection including pain, swelling and warmth around the wound site, pus and fever. Second complication from improper management of open injuries is tetanus, also known as lockjaw, a serious nervous system disease from a toxin-producing bacterium that causes muscle contraction. Severe complication of it can be life-threatening, and there is no cure. The treatment focuses on managing symptoms until the effects of tetanus toxin is resolved. Next complication is slow healing and also scarring. Finger cut or incised wound is quite common. Many cuts can be easily treated at home, but if it's too deep or long, please seek a healthcare professional for medical care such as stitches, tissue glue, or staples if necessary according to the physician's advice.
Now, let's proceed to do's and don'ts when treating open wound. First of all, clean the wound gently under cool running water. This step helps to flush out dirt, debris, and bacteria that may have entered the wound during the injury. Next, use a clean, damp cloth or clean tissue to wipe the wound carefully. Second, cover the wound by choosing a plaster that is slightly larger than the wound, ensuring it fully covers the area and to keep out dirt and bacteria. Place the plaster gently over the wound. Make sure the padded part is directly over the wound and press down the edge to seal it securely. Next, don't use skin cleansers, antibacterial soaps, or strong chemicals like hydrogen peroxide or alcohol directly on the wound. While this might seem like good options for killing bacteria, they can irritate the wound and delay healing by damaging healthy tissue. Lastly, don't apply lotions, creams, or oils directly to the wound unless specifically advised by a healthcare professional. These substances can trap bacteria and create an environment where infection is more likely to develop.
Safety precautions when using sharp tool. Safe handling while using sharp tool. First is to use proper technique. Handle the object with firm grip and apply control pressure. Always cut away from the body, not toward it. And then focus on the task, avoid distraction and stay attentive while working. And then secure the object, hold the item being cut firmly to prevent slipping. Next is you need to keep others safe. Ensure no one is in the direct line of the blade or sharp object. You need to pass safely by handing a sharp object to someone by present the handle first, not the blade. After using sharp object, you need to clean the tool. Wipe and clean the sharp object properly after use to maintain its condition. Store properly. Keep the sharp object in safe locations such as design holder. And you need to dispose the sharp correctly in proper sharp container.